Hello, once again, and welcome to Third Eye TV Africa. We are at the center of Abuja, and we want to look at mental health. We want to look at crime. Are they related? Crime and mental health. Some say many people were born with some mental issues. Some will say no, some societies made them so, factors in society. Some will say no, by virtue of association, they got entangled. What really is the situation? And can that lead to criminality? These and many other things we shall be discussing, especially that we also have to have a law that will look at what mental health is all about in Nigeria. Do mental people have their own rights? What does the law say? What should government do? What should society do? There are also instances where some people would just reject people they tend to see of strange behavior, associating it with Satan, devilish forces here and there. Well, we shall come to all of this. My name is Ben Shaman, and I have a psychiatrist of note, a consultant for the National Hospital here in Abuja. I'm talking of Dr. Olusegun Shoyombo. You're welcome, sir.
Thank you, sir. Good morning and good morning, viewers.
You're welcome again.
Thank you very much.
Now, let's look at this assertion. Where are we? When they say some people were born mad, some inherited, some acquired along the line, as an expert in the field, can we have a breakdown of this?
Let me start by saying that your intro is loaded. You have said many things. You have covered many aspects of psychiatry in that very brief introduction. But I want to start the discussion with this last question that you have asked. Are there people who were born? First, we will not say mad. That is part of what we need to correct. That is a derogatory language. That is a language that enshrines stigmatization. And in your intro, you talked about the rights of people with mental illnesses. Using words like mad and lunatic is what makes people's rights to be abused. And we are going to be doing a lot of back and forth in the course of this discussion. So maybe the question I should be answering is, what causes mental illnesses? First is that there can be genetic predisposition. And that doesn't mean people are born with mental illnesses. The same way somebody can have hypertension. And if he has hypertension, it means that his offsprings have a chance of having hypertension, isn't it? And it doesn't mean that if he has 10 children, all the 10 children will have hypertension. If there is one of them who eats carelessly, drinks carelessly, lives a sedentary lifestyle, then the genetic factor will add to environmental factor, and then he can express that gene for hypertension. The same man has a child who exercises regularly, who is careful about what he eats and what he drinks, he watches his weight and controls other factors. The child from the same parent may not have hypertension. That is to say that though there is genetic predisposition, it is usually an interplay between genetic factors and environmental factors. So I will say no, nobody is born mad, to answer the questions directly. Can it be acquired along the way? Yes, even in people who were not previously predisposed, in other words, they do not have a family history of mental illness, they can develop mental illness. Maybe we should backtrack, Mr. Ben, and discuss what mental illnesses are. These are a set of illnesses that affect our emotions, affect our behavior, affect our mood and our thinking. Now, is there any human being that would say that he hasn't had one aspect of these four things affected at all in his life? So that if we all are faced with sufficient stress factors, we may express one type of mental illness or the other. When we say somebody has a mental illness, it doesn't mean he's walking naked on the street or in the market. Only a very tiny fraction of people with mental illnesses behave like that. Unfortunately, that's the general depiction of people with mental illnesses. Not to derail completely, let's come back to what we're talking about. So we've talked about the genetic predisposition. We're not talking about acquiring the illness along the way. So somebody who has no family history but begins to, say, smoke weed, cannabis, that can trigger what we call precipitate a mental illness in this person who was not previously predisposed. Somebody who was not previously predisposed to mental illness faces a severe life situation and becomes depressed. That life situation has precipitated a depressive illness in that person. That is where we all have to be careful so that we don't laugh at people, we don't scorn, we don't mock, and we don't denigrate people just because they have mental illnesses. Anybody can suffer from a mental illness. Because when we talk about mental illnesses, we're talking about a very wide range of illnesses. Some people don't sleep well. They go several days and they are unable to have satisfactory sleep. When it is time to treat them, they may be referred to a psychiatrist. That doesn't mean they are mad, quote and unquote. Some people have anxiety. They are anxious about certain things. Sometimes they are anxious about nothing, just a general free-floating type of anxiety. And when it is time to treat them, they will be sent to a psychiatrist. Neither of these two categories of people are walking naked on the street. We have our servicemen working bravely, tirelessly to keep our country safe. Some of them on the war front, faced with very tough conditions and sometimes with severe trauma, life-threatening trauma. They can develop what we call a post-traumatic stress disorder, isn't it? That is a mental illness. We have children born with conditions that can happen from very early life. We talk about autism, we talk about attention deficit, hyperactivity disorder, other learning disorders. These are to be treated by the psychiatrist. Let's talk about women. Women desire to get married and get pregnant to have children. But as a result of that, they can develop certain of illnesses. We've heard of postpartum depression, postpartum blues, coming from the natural process of getting pregnant, delivering a baby, and caring for a small. We're going to call the woman because she had a child. So we've talked about genetic predisposition. We've talked about acquired illnesses that can arise from things like drug abuse, that can arise secondary to other conditions. The important thing is that when a mental illness is present, it should be identified and it should be treated. And people with mental illnesses should be treated with their rights respected.
Very long explanation.
Too long.
Very, very catchy.
I'll try for the others not to be this long.
No. It's okay getting it right, so to speak. That was why I also didn't want to interrupt, so that we have a flow kind of thinking. You know, we are dealing with a mental case, so that. Now, let's look at laws in Nigeria. Are they protective? Do we really have even laws in terms of handling this class of?
We finally move forward after several decades of not doing so. Before 2023, in the twilight of the President Buhari administration, the law that regulated treatment and dealing with people with mental illnesses was called the Lunacy Act.
The name is already
even the name itself is derogatory. The Lunacy Act of 1958. Nigeria gained independence in 1960. So it was a colonial era law. That law, its main focus was to protect society from the lunatic. It gave no consideration to the rights of the person with mental illness. So he talked about taking somebody and locking him up in an asylum. And if there is no money to pay for his treatment, if he has property, we can sell that property and use the proceeds to pay for his treatment. So no protection at all for the person suffering from the illness. He just talks about shielding society and uses such derogatory terms. After many attempts from stakeholders in the mental health industry in Nigeria, psychiatrists, psychologists, psychiatric nurses, and social workers, and development partners, and all that, finally we had the Mental Health Act passed into law, signed by President Muhammadu Buhari. So it's called the Mental Health Act 2022. This law, on the other hand, protects the rights of a person with mental illnesses. It protects them from discrimination, protects them from abuse. It regulates the practice. A doctor cannot go and impregnate his patients or have any sexual relations or business dealings with his patient, because you are taking advantage of that patient at that time. So it talks about things like that, and most importantly, it talks about government committing funds to the treatment of people with mental illnesses, because somebody has a mental illness and as a result of that cannot hold down a job. Are we just going to depend on family to pay? What if there's no family for his treatment? So government commits to making funds available for the treatment of people with mental illnesses. So finally, we are moving in the right direction in terms of the law, as you asked. However, there are still other hurdles to cross. Signing a law is one thing, implementation is another. So there are steps to be undertaken, there are things to be put in place, and I would say with advocacy, we are moving in the right direction. Maybe we are not moving fast enough, but we are moving.
Now, you see, some people still believe that when they begin to see some strange behaviors, and even adults, old people, not to talk of the young, they begin to associate it with Satan, evil spirits. Now, how do we come out of this?
So we are back to discussing causality. What causes mental illnesses? And usually when I discuss what causes mental illnesses, I will also discuss what does not cause mental illness. Let us go to the non-controversial areas. You don't catch mental illness because somebody who is mentally ill has beaten you, use his teeth and beat your hand, maybe in a struggle. No, mental illnesses are not transferred that way. Mental illnesses are not sexually transferred. If somebody is married or has a sexual relationship with somebody and the person develops a mental illness along the line, it doesn't mean that, oh, once you have sexual relations with that person, you too will have the mental illness. We have said that women can have postpartum psychosis. Abi?
Yes.
The woman has a baby. She cannot transfer that mental illness to that baby by breastfeeding. So the presence of that mental illness does not mean that the woman cannot breastfeed. The decision about breastfeeding is purely a decision that is based on safety. Is it safe for the baby for her to do so? So, for example, if there are other people present who are watching and making sure that there's no harm that will happen to the baby, the woman can breastfeed. But if they are scared that the woman is maybe she has some abnormal belief or thoughts towards that child and can that child, then that is grounds for not breastfeeding. The point is that mental illness cannot be transferred via breastfeeding. Are mental illnesses caused by witches and wizards? Mr. Ben, if we get into the discussion, other people will come and join us here and the discussion will not finish. But this is how I answer the question all the time. Are these witches able to cause accidents, road traffic accidents? I'm asking you, you are the moderator. Let me ask you a question, Mr. Ben. Can witches are able to cause accidents on the express and the person sustains a fracture in that accident, will he be treated in an orthopedic hospital or will he be treated at a herbalist home? If he will be treated in an orthopedic hospital, there is no debate. Whether it is with mental illness, the important thing is for people to have access to medical care. I will repeat myself. Let us leave accidents. Mental illnesses are not the only illnesses that people have, and attribution is made to extraterrestrial powers. Okay? Some person can have a stroke, somebody can have cancer, and they say it's an attack from the enemy. Yes, an attack. If it is cancer, it should be treated by the oncologist. If it is stroke, it should be treated by the appropriate physician, whether it's the neurologist, whether it's the neurosurgeon that will treat it. Therefore, when people have mental illnesses, they should please be given the opportunity to be treated in a hospital. And this is why we are very religious people in this part of the world. We pray a lot. It is easier to pray for somebody you do not see than for the doctor to treat someone he doesn't see. Even if a woman is in labor room, her relations are outside, what are they doing? They are praying. When the woman delivers safely, is it the prayer that worked or the expertise of the doctors and the midwives? We are not interested in sharing glory. Give the glory to God. So if a patient has a mental illness and you think it is caused by Satan or witches or something, bring the patient to hospital and go and be praying for the patient. When the patient is well, go and give glory to whoever you want to give. I have skirted around the question.
Well, it's understandable. Now, you do have some association that are actually so vehement in terms of trying to see government and ensure that government actually does what it ought to do to protect these people. This brings to mind the state of our psychiatric hospitals in Nigeria. What is it like?
Incidentally, Mr. Ben, just a few days ago on Tuesday of this week, the president of the Association of Psychiatrists in Nigeria, Professor Taiwo Bindo, who is a professor of psychiatry in the University of Jos, he was in Abuja with some members of his EXCO to pay a courtesy call on the Honorable Minister of State for Health and Social Welfare. And I was in attendance at that meeting. We were very well received. I was very happy with the interest that the Honorable Minister showed in matters concerning mental health and the commitments he made concerning the implementation of the Act, which has been signed into law, and other commitments he made to support the work that we are doing. Of course, there are other associations. The psychologists have their association. There are people who are not even trained in mental health matters, but who are just passionate about, who also belong to different groups, and they are all stakeholders. You also have support from international partners. For example, you have the United Nations Office on Drugs and Crime that supports treatment that relates to drug abuse related issues, and the European Union and things like that. So you have intersectoral collaboration, federal government, state governments, development partners, professional bodies like ours. We are making progress. There are challenges, there are big challenges. For example, Japa syndrome, you do not have enough hands, definitely. But certain hurdles are not very easy to overcome. For example, in that meeting, a commitment was made because implementation of the law requires certain collaboration between the Ministry of Health and the Office of the Attorney General, or the Ministry of Justice. You see, so those are things that take time and all that. So I think we're making progress in that area.
Yeah, you've been listening to and also watching Dr. Olusegun Shoyombo. He's a psychiatrist, in fact, a consultant at the National Hospital, and we are discussing crime and mental health. Even though for now we've been talking about health, we've not gone into the crime aspect. Is there a marriage? And of course, my name is Ben Sherman. We are reaching you from Third Eye TV, Central Business District area in Abuja. And now let's try and see if there is a marriage, a correlation between crime and mental health. Is there a marriage there?
There is a marriage. It's a very delicate marriage. It's a very misconstrued and misunderstood marriage. There are many people out there with the assumption that the mentally ill person is usually a dangerous and a violent person. The reality is that the vast majority of people with mental illnesses are not dangerous or harmful to anyone. The vast majority of them are actually more at risk of violence from other people. Mr. Ben, let us use that bad word, mad. Have you not seen a mad pregnant woman? Who got her pregnant? That's sexual abuse. If somebody who is mentally ill and is vagrant and roaming about the street walks towards some people, they are likely to pick up sticks and stones and attack the person. Then the scourge of ritual killings. A mentally ill person who is homeless and just roaming about is at risk of that. So they are at risk of various kinds of violence and crime committed against them. However, it is possible for a mentally ill person, as a result of the symptoms of the mental illness, to be violent. It is possible. If somebody has an illness, for example, that makes them feel threatened by situations or people around them, they may feel like the way to protect themselves is to attack first. Sometimes they have what we call abnormal perception. I can be looking at this and think I'm looking at a camera, but somebody who has a mental illness, instead of seeing a camera, can be seeing a lion and feel threatened and feel that the only way to do now is to attack this object so that it doesn't attack me first. They also have abnormal beliefs. Those were the things I talked about earlier. So somebody believes that his wife is unfaithful or her husband is unfaithful, or there are some people coming, they were planning to kill him, or things like that. Those things can push them to violence. However, when illnesses are identified early and treated, it usually will not get to that point. The risk of violence, the risk of harm, including harm to self, because every time we talk about violence, we are talking in relation to other people. People with mental illnesses can also harm themselves. We've all been hearing about the scourge of suicide and self-harm in society. Another thing is that drug abuse is a form of mental illness. And when people take mind-altering substances, they can act in erratic ways. They can become very dangerous, they can become very violent and do things to harm other people. So yes, there is a marriage.
Now let us look at therefore drugs and crimes. You know, we tend to see that they also like cousin brothers, drugs and crime.
Well, yes. Let us speak crime alone. Because again, there's been that misconception when people are involved in dangerous crimes, when people are involved in massive fraud and things like that. People tend to say, is this person well? Is this person normal? I think that it is a disservice to the people who genuinely labor under the burden of mental illnesses. The vast majority of them don't go about committing crimes. Most crimes are committed with people that are very clear in their mind what they want to do. Are we together, sir? Most crimes are committed by people who are very clear in their mind. Most frauds are committed by people who are very clear in their mind. And when a crime is committed, it is treated first and foremost as such. The managers of our security and our judicial industries know when to send a patient for assessment. They know when to send somebody and say, this person that we're investigating or we are prosecuting might not be mentally stable. So the reverse is not the case. It is not that we first say the person is not well. When a crime has been committed, it has been committed. The law enforcement agencies will take charge, and then when they have reasons to believe that the person is unwell, they will send the person for an assessment. Sometimes crimes have been committed by persons who already have established mental health diagnosis. In that case, they will reach out to the institution treating and we can say, yes, this person has an illness. Does it mean that the person is set free from responsibility immediately? Not quite. Not quite. Because what we want to do is to make sure that that person doesn't continue to pose as a danger. It is a two-way street. Committed by people who use drugs are not committed because they use drugs. Rather, they have used the drugs as an enhancer for the criminal intent that they have. If you listen to police, you watch police files and things like that, you will always see that when people want to go and commit crime, they use some mind-altering substances that make them bolder or keep them awake for longer period, and then they are able to perpetuate their crime.
Now, sometimes the evidence around,
And sometimes you have the
you
evidence
see
around. Yeah,
some
so
cocaine,
yes.
some.
So again, it is also possible that people who would ordinarily not commit crimes, when they have used mind-altering substances, their inhibition is removed. So sexual abuse, sexual assault is a crime, isn't it?
Yeah.
So somebody who maybe ordinarily was not planning to touch somebody in an inappropriate way or harass somebody has had a few too many bottles of alcohol and maybe one or two other drugs, and then that inhibition has been reduced. Then it goes to abuse somebody. So you see that it is a two-way street. So some use it as an enhancer. They already had the intention to go and commit crime, then they go and use the drug to enhance their performance of the crime. Some, because they have used drugs, their inhibitions are reduced, then they go and commit a crime. It is usually difficult to difference. Okay, so we stay on the side of medicine, we allow law enforcement and do the side of crime.
Now, and let's look at let's take this part, this last portion of the interview, to look at those who are under trauma. We have soldiers, whether in Nigeria or DR Congo, what has happened in the Middle East, Israel, Palestine, and some other areas, Syria. Sometimes people live under trauma because of war situations, conflicts, things they never expected. Then suddenly it has come. They are so traumatized. Now in Nigeria, people go to fight against terrorism, bands and all that stuff. Or even people who have been kidnapped. The kind of trauma they live in under being hostages or a hostage. What kind of handling professionally, health wise, do we need to do to make these people forget the past?
I'm not sure there's anything you can do to make them forget. You can't
So
particularly
how
why.
can they manage? How can
So,
we manage
so
the situation then?
how to manage the situation is, let's use this spate of kidnappings and banditry, the things that happen locally, as an example. When a person is rescued from their assailants, from the kidnappers, the first thing you want to do is to get them to hospital and make sure they are dying and check the status of their health. And that includes checking both their physical health and their psychological health. So the first thing is safety. You keep them safe, then you keep them physically safe. There's what we call psychological first aid, which is a first level intervention, not necessarily practiced by doctors. Different kinds of professionals can be trained on providing psychological first aid, but it is something that is delicate because we actually don't want to fish. Psychological trauma is not something you want to dig to find. You just want to provide a supportive environment so that when the individual himself is like discussing a topic, he discusses it. Somebody cannot have been kidnapped for several weeks, and then you are asking the person, did they slap you on the right cheek or did they slap you on the left cheek? And did they put you inside the hole or did they lock you inside? You understand? You are re-traumatizing that person. However, as that person feels more and more comfortable, he will address issues that are on the front burner in his heart. What we will do when people come out is to provide that supporting environment. When you see fear, you see what we call startle reaction, avoidance reaction. Somebody doesn't want to discuss that topic at all. These are some of the symptoms you see in post-traumatic stress disorder, PTSD. Somebody who has been kidnapped, the moment they start showing on television that so person was, it just changes the channel because it doesn't even want to hear that word at all. The moment you close the door, it jumps because it thinks an attacker is coming and all that. We can provide support and help with all of these symptoms, and things will gradually settle. So, to the best of my knowledge, when the security agencies help and get these people out alive, some of these services are provided for them.
Because I'm asking this because I met, a military officer. And I said, oh, how far? Long time. He just said, "Yeah, all the while, the last 5 years I've been in the Northeast. I'm just back. So what do you do thereafter?" I said, no, I don't go out. Sometimes it's like I'm hearing the sounds of guns and blah, blah, blah. So how do you handle such a person?
So the military have their own debriefing mechanism. Most of those who will go to a combat situation in the military will not have PTSD. They may have some adjustment reaction. It's like you go and swim and you come out of water. Sometimes you look as if you are still inside water. So they may have some of those experiences. But to make a diagnosis of a mental health condition, you are looking at severity, and then you are looking at how it affects the person's functioning from day to day. So the vast majority of them will readjust over time. However, there will be those ones who will have severe symptoms that will be persistent, and those ones will have to be helped clinically. The military has its own professionals. Sometimes, because they don't have enough, they also lean on the civil professionals and send people to specialist hospitals for assessment. I know that in the recent past there were discussions about setting up a veterans hospital here in Abuja, and one of the core mandates was to provide care for this category of persons. So I will not say that they are without care. We must admit, generally, not because of any laxity of the environment that we are in, there is what you call the mental health gap. And what is that? It is the gap between those who need services and those who are able to access services. Most people who need may not even know that this is what they need. So they may have symptoms and not realize that these symptoms are mental health symptoms, or there are reasons why they should go to the hospital and seek help. Now, for those who realize that they need help, how readily available is the help? One, geographically. Most of our treatment centers are in the urban areas. The bulk of our population are rural dwellers. Not every place is within a few minutes drive of seeing a consultant psychiatrist or a specialist doctor. How about financial accessibility? If they go, do they have the money to pay to access the services? It brings us back to the JAPA issue. We do not have enough hands. There are too few of us providing services for over 200 million people. That is not good enough. People will have long waiting times to secure appointments. The doctors will be overworked. They cannot settle down and do very thorough job on each patient that they see. But we make the best out of a bad situation and hope that things will improve.
For things to improve, I saw that General Buba Marwa, the chairman of the National Drug Law Enforcement Agency, is proposing, in fact, calling that all those who want to contest to hold public offices, or if you're already high up there, that some should go some mental checkup because of the kind of stealing that is going on. One man will just take billions. I mean, what kind of a form is that?
General Marwa has spoken from the passion. I've spoken from the side of passion. It will be a huge strain on your already strained services to begin to conduct assessment for people because they want to contest election. If I say you are well today, does it mean you will be well tomorrow? Number one. Number two, I have said it earlier. Most of these people commit their crimes with very clear mind. They know exactly what they are doing. We shouldn't reduce these bad behaviors to mental illness. It is unfair to those who genuinely labor under the burden of living with a mental health condition. When people commit crimes, they should answer to their crimes. Haven't you noticed that when it is time for whether General Marwa or the EFCC people or police to arraign certain top flight people in court, all of a sudden they have a neck collar, or they are using crutches, or they are sitting on a wheelchair? But nobody has ever said, no, I can't face trial, I'm mentally sick. They don't ever lay claim to a mental illness. They lay claim to all kinds of things, but never a mental illness. So let's leave it at that. If they have committed a crime, let them answer to their crimes. If there is evidence that somebody is laboring under the burden of a mental health condition, it will be sent for assessment. We do not have enough doctors. We should not overburden them by creating an extra layer of work. You know, they are going to come entitled. They are big people. They will not necessarily come and queue, and then they will deprive people who genuinely need services the illness. So I don't agree with the general, respectfully.
Okay, but let's see whether you agree with this one. Sometimes driving, I mean, across states in Nigeria, there are times you just see some people are mentally ill, let's call it this way, just roaming around, untaken, I mean, so unkept, dreadlocks. I mean, you don't even know how they fit to start with. You know, how do you feel as a psychiatrist looking at such people? First of all, do we agree that we have such people roaming around?
We do, and when we see them, we feel very bad. Very, very bad. Some time ago, right here in central area in Abuja, I was driving to work and I saw a young woman, maybe in her 30s, stark naked completely, no item of dressing at all on her, and she was just walking in the middle of the road. Now, if you stop, what can you do? Some people can kill her. So what I did was to pick up my call the FCT social services and describe the location and described what I saw, and I'm happy to say that they dispatched a team to pick the person up. There are illnesses that can make people wander away from home, and people can become vagrants. You see them, they've not had a shower in years. Their hair is unkept. They don't look at the road. They just roam about. They manage to pick items around and eat and all that. So you see, there are illnesses that can cause that. A while ago, as a young psychiatrist in training here in Abuja, we had a patient who was brought in by a radio station, brought into the National Hospital. He didn't even know his name. He was an elderly man. He didn't even know his name. He was registered as unknown. First name unknown, second up, and then the nurses had to clean up. Or you see, miracles still happen because another patient was admitted beside him. And when the relations of that patient came, they said, this is our neighbor in Zaria. They have been looking for him for the past 4 years. So there are illnesses that make people do that. What we need is to fund the social services more. Every state should have a functional social services department that can pick these people up, keep them in a safe place, provide some level of care pending when relations can be identified and they take them home. And if relations don't show up, they continue to be in the care of government. But nobody should be allowed to be exposed to the elements of weather and crime and society without anybody caring for them. So it's something that really makes me feel bad, and I think that's a gap we really need to improve upon.
Now, let me allow you to give this parting shot. If you were to be President Bola Tinubu, if you were to be the Minister of Health, Nigeria, how will you handle mental cases?
Thank you very much, Mr. Ben. This one should be more than a parting shot. Number one, I'll give strong preference and priority to implementation of the Mental Health Act, because whatever you do as a person is more likely to outlive you if it is enshrined in the law. Otherwise, it will just be that when he was president or when he was minister, he did so, 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 and so, and after he's gone, nobody will carry on like that. So the aspect of funding, the aspect of rights protection, if I were the president, I would work very hard with governors to make sure that we have very strong social services department. We are fast losing our fabric of family support. In this country, if a person is mentally ill, the people who show up to provide care will be family. However, the families have started to japa internally and japa externally. The cohesion we used to have as a people is fine. We are becoming more westernized. People mind their businesses. Therefore, our social services department must grow to meet the demands. If I were the president, I would be very hard on crimes related to drugs. Those who sell these drugs, those who smuggle them into our country and sell them to young people, destroying lives, destroying families, I'll be very hard on them. I'll strengthen the NDLEA. I would ensure that prosecutions are done swiftly and that judgment passed and implemented to serve as deterrent to others. I will fund very adequately our hospitals, not just the psychiatric hospitals. All our teaching hospitals have departments of psychiatry. We don't have enough beds for people. But if we had enough beds, we wouldn't even have enough doctors. So the priority for the president and for the minister would also be how to retain our manpower. We can't be training people and be losing them to the Western world that contributed no kobo to their training, and our own people do not have access to treatment. So that whatever it takes to keep our people here and providing avenue for reverse brain drain for people who have gone and wish to come back, let us make it easy for them to come back. Let us give incentives for them to come back so that our people can have access to services. This is a question I should have thought about. This one was a joker from under your table.
Well, you've listened to him. You've also you've seen him. The issue is we now have an act that has to protect those who are having some psychological challenges. We also have to be kind to those we see in the street, and of course we have to drop some names, some terms like mad person, because they are human. Show them love and they change. Should politicians go into some psychiatric tests before they are even allowed to contest? Well, Dr. Sheyombo says no, because those who indeed have decided to go into criminality have decided it boldly, fully knowing that